On February 28, 2025, Robby Witt recorded an interaction with a California hospital customer service agent. After a medical bill for an ER visit, an ambulance doubled when the organization applied his insurance to the bill. His frustration is shared by the nearly 32.5 million likes on Instagram and TikTok. In about 2.5 weeks. We were curious what counsel the Mac had for Robby's situation.
Hi, I'm the Marshall Allen clone. I've been trained by Marshall on all of his years of research and writing around how you can navigate the healthcare system without being taken advantage of. Before we start, be sure to click the person icon to the right to register for free and save your conversation for future reference. How can I help you today?
Hi Mac. Can you listen to this conversation between a friend and a hospital employee? They are negotiating a bill discrepancy. There was an emergency room visit via an ambulance. And the price dispute is due to a price change by the hospital before and after the patient provided their insurance information.
So I think there's a mistake on the bill, but maybe you could help me out. We got a bill, and then we realized that you guys didn't have our insurance, so we sent you the insurance, and it looks like the bill went up.
It went up?
Yeah, the first bill we got without the insurance was $600, and then the second one was almost $1,300.
Okay. Yeah, so that the first invoice you received, that's a discount that you receive if you're uninsured. So you're not eligible for the discount since you are insured. And so the bill was $2,342.14. We billed your insurance. Your insurance only paid $1,078.85.
Can I go back to the discount without the insurance?
No, so you're insured, so you're not eligible for the discount.
If I go cancel my insurance, am I eligible for the discount?
No, sir, because we checked eligibility and you do have active coverage for data service.
Oh, I needed to cancel it before I got the service to get the discount.
You're only eligible for the discount if you're uninsured.
Okay, so I'll get cheaper health care if I'm uninsured.
If you're uninsured, you're eligible for the discount, correct?
Is this common? Like I pay for insurance and I end up paying more out of pocket because I pay for a premium? That's wild.
No, this is just a new law that passed or started 2024 AB 716, and the law is if you receive a discount if you're uninsured.
Okay.
So when we first send a invoice to the patient, we bill them as if they're uninsured. If you're insured, unfortunately, you're not eligible for the discount.
Okay, so just if I have the incentive straight here, if I want to pay less for medical care, I should cancel my insurance if my daughter needs life-saving medical care?
I'm not sure. I don't know, sir.
You
should cancel your insurance. I'm just letting you know that discount's only for patients who are uninsured.
Okay, that is special. That is a special law. So there's no way to put that discount onto an insured person. Only the uninsured people get that.
Correct.
Seems counterintuitive when you're paying for insurance. It's all about how contracts are negotiated between insurers and providers. Unfortunately, those agreements can sometimes lead to insured patients paying more than if they were uninsured and paying cash. It's maddening, but it's not uncommon. Have you tried asking the provider to match the cash price despite being insured? It's worth pushing back and seeing if they'll make an exception. If they refuse, you might want to ask for an itemized bill with billing codes to ensure everything is accurate and fairly priced. Would you like help drafting a request or disputing the charges?
Yes. Thanks.
Here's how you can push back effectively. First, request an itemized bill that includes the billing codes. These codes are crucial because they tell you exactly what services were billed. Once you have them, check that the codes accurately reflect the care you received. Then use those codes to compare prices on websites like fairhealthconsumer.org, healthcarebluebook.com, or trybilly.app. This will help you determine if the charges are fair. Next, dispute the bill in writing. Clearly state that you believe the charges are incorrect and explain why. If you'd like, I can help you draft a template for this. Providers often respond better when they see a formal, written dispute. Finally, ask the provider if they'll match the cash price, even though you're insured. It's not guaranteed, but it's worth trying. Many providers are willing to negotiate, especially if you're persistent and polite. Would you like me to help you draft that dispute letter?
Yes. That would be helpful. Thanks.
Here's a template you can use to dispute the bill in writing. Dear provider's name or billing department, I am writing to formally dispute the charges on my medical bill dated insert date. After reviewing the bill, I have concerns about its accuracy and fairness. Specifically, I noticed that describe the issue, such as the charges increased after insurance was applied, or the prices seem higher than expected. To resolve this, I am requesting the following. 1. An itemized bill that includes billing codes for each charge. 2. Confirmation that the billing codes accurately reflect the services provided. 3. A review of the charges to ensure they align with fair market prices. I have researched fair prices for these services using resources like Fair Health Consumer and Healthcare Blue Book, and I believe the charges may exceed what is reasonable for my area. Additionally, I ask that you confirm whether my insurance processed the claim correctly and applied all eligible discounts. Please respond within insert reasonable time frame, like 30 days, to address these concerns. I am committed to resolving this matter fairly and promptly. Thank you for your attention to this issue. I look forward to your response. Sincerely, your name, your contact information. Once you send this, follow up persistently. If they don't cooperate, let me know, and I can guide you on next steps like escalating to your insurance or even considering legal options. Does this template work for you?
That's helpful. Thanks. Can you describe or tell me about California Law AB 716 from the year 2024?
It sounds like you're referring to California Assembly Bill 716 from 2024. This law seems to address the issue of billing practices that often result in uninsured patients receiving discounts, while insured patients are charged higher rates for the same services. This kind of price discrimination is a huge problem in healthcare. It's not just unfair, it's exploitative. Hospitals and providers often justify these practices by pointing to the negotiated rates with insurance companies. But the reality is that insured patients frequently end up paying more out of pocket than uninsured patients who negotiate cash prices. This is a systemic issue that laws like AB 716 aim to address by creating more transparency and fairness in billing. If you're dealing with a situation where you think this law might apply, I'd recommend getting an itemized bill that includes the billing codes. This will help you determine if the charges are reasonable. Have you already received a bill that seems unfair, or are you trying to understand how this law might protect you? Let me know and I can guide you further.
Is it the case that once AB 716 is applied and the hospital knows a patient has insurance, they will no longer receive discounted prices? Is there a discrepancy or difference between a discounted price and the cash price?
Yes, there's often a big difference between the discounted price and the cash price, and it's one of the most frustrating quirks of our healthcare system. When hospitals know you have insurance, they typically won't offer you the cash price because they're locked into the rates they've negotiated with your insurance company. But here's the kicker. Those negotiated rates are often higher than the cash price they'd offer to someone without insurance. It's backwards, right? For example, I've seen cases where an MRI might cost $1,100 with insurance, but only $300 if you pay cash. That's because the cash price is often set lower to attract uninsured patients, while insured patients get stuck with the higher discounted rate their insurance company negotiated. It's a system that punishes people for having insurance, which is absurd. If you're in this situation, you should still ask for the cash price. Hospitals aren't legally required to give it to you if you have insurance, but some will if you push. And if they refuse, you can always ask for an itemized bill with the billing codes. Have you tried asking for the cash price yet? Or do you need help figuring out how to approach the hospital?
The hospital representative did not reveal what the cash price would have been, just the discounted price. What if Robby was denied the cash price?
Hospitals and medical providers often deny the cash price to insured patients because they're tied to the rates negotiated with insurance companies. These contracts usually prevent them from offering insured patients the lower cash price, even if it's more affordable. It's frustrating because insured patients who are already paying premiums can end up paying more out of pocket than someone without insurance. Have you tried asking for the cash price directly? If so, how did they respond?
Thanks. Maybe Robby should ask for the cash price, instead of the discounted price, to see if that is a third number yet to be revealed. That's enough for today. Thanks for your help, Mac.
You're welcome. If you ever need help navigating the healthcare system or have questions about saving money on medical expenses, don't hesitate to reach out. Take care.